Hello, how are you doing today?
I'm good, how are you?
Good, thank you. So my name is Ashley and I'm going to be your nurse today. Can you just state your full name and birth date for me?
Savannah Norma Rhoda, February 5th, 2001.
Perfect. So today I'm a first year nursing student from Lethbridge College and today I'm going to be performing a head to toe assessment on you today. Is that okay?
Yep.
Perfect. Do you have any questions or concerns before we start?
No.
Alright, so for my head to toe assessment, I'm going to be starting at your head, going down all the way to your toes, using techniques such as looking, feeling, some tapping, as well as listening with my stethoscope. You okay with all that?
Yep.
Awesome. So just a couple questions to start. Do you know where you are right now?
I'm still at Grace Hospital.
And what's today's date?
March 30th, 2020.
Perfect. So alert and oriented times 3. Alright, I'm going to palpate the cranium. Any pain with this?
No.
Alright, so hair is evenly distributed. Scalp is pink with no flakes or lesions. Taking a look at the face, skin is all intact. Face is symmetrical. Going to go ahead and palpate the temporal arteries. Those are felt bilaterally. Can you open and close your jaw? Perfect. Temporal mandibular joint is freely movable as well as no crepitus. Going to palpate here. Let me know if you have any pain.
No pain.
Okay, so frontal and maxillary sinuses are palpable with no pain. Carotid pulses, those are felt bilaterally. Okay, go ahead and just feel around your neck here. Perfect, so there's no palpable lymph nodes. And now I'm going to move on to your eyes. Okay. So taking a look, the sclera is white, conjunctiva is pink. Are you okay if I shine a light in your eyes? Pupils are equal, round, and reactive to light. Can you just follow my pen for me? And accommodating, perfect. So now we're going to move on to the nose. Taking a look at it, it is midline. Nostrils are patent bilaterally, nasal septum is intact, and there's no flaking, lesions, and no discharge. So now we're going to move over to the ears. Just going to palpate them first. Any pain with this at all?
No.
Perfect. So I don't see any lesions, no crusting. Ears are symmetrical and aligned. Just going to look inside. There is moist yellow cerumen in both ears. Okay, now we're going to move to your mouth. So just a couple quick questions first. How has your appetite been like lately?
Good, 3 meals a day.
Perfect. Nothing out of the ordinary?
No.
Perfect. So can you open your mouth for me? Awesome. So I notice that lips, gums, and mucosa are all pink. Can you stick your tongue out? Tongue moves freely. It is rough with no lesions. And can I see your teeth? Perfect. Normal teeth are white and intact. So we look at your neck now. Can you swallow for me? Perfect. Swallowing reflex is intact. Trachea is midline. When I look in the mouth, I also notice that the pharynx is pink and intact. Can you tilt your head to the left for me? Okay, I noticed no jugular venous distension. Okay, now can you move your head side to side for me? Front and back. And look right and left. Perfect, so neck has full range of motion with no crepitus. Okay, so now we're going to move down to your chest. Are you okay with just exposing it a little bit?
Yeah.
So I can get a better view. Perfect. Couple questions while you're doing that. Have you had any troubles breathing lately?
No.
Any cough?
No.
Any mucus coming up?
No.
Perfect, so client denies any cough or sputum. So taking a look at the chest here, it looks symmetrical. Skin is even with no lesions. A few moles noted on the chest, however they're all regular moles. Breathing is non-labored, moderate depth, and equal expansion and contraction. So I'm going to go ahead and listen to your lungs now, after I sterilize my stethoscope. When I listen to your lungs, I'm just going to ask that you please don't talk, just so I can get a better listen.
Yeah.
Perfect, and at each spot, I'm just going to ask you to take a deep breath in and out. All right, in and out. And again. Are you okay if I move your sports bra?
Yeah.
Okay. In and out. And again. And again. And again. Perfect. Now can I just get you to sit up so I can take a look at your back?
Yep.
Perfect. So taking a look at the back here, skin is all intact, no rashes, no lesions. Palpating the spine here is straight, scapula are symmetrical, so I'm going to go ahead and listen. So just same thing, big deep breaths in and out. Perfect. So breath sounds are clear bilaterally, no wheezels, crackles, or rubs. Air entry into all lobes is equal. Okay, so now we're going to move on to your heart. So taking a look at the precordium here, I notice no deformities, no heaves or lifts. So we're just going to go ahead and listen. So before I listen, is there any heart conditions that I should know about you have?
No.
Perfect. So when I'm listening again, just please don't talk so I can get a good listen. So first the aortic. then the pulmonic. And you're okay if I move your sports bra
Yeah.
in? Tricuspid. Mitral. And lastly, I'm going to listen to your apex for 30 seconds for apical pulse. Okay. Perfect. So S1 and S2 were heard in all of the regions. Pulse was a rate of 72 beats per minute. No murmurs or adventitious sounds were heard. Okay, so now we're going to move down to your abdomen. So you're okay if I just pull this down a bit? Perfect. So, taking a look at the abdomen here, I notice it is symmetrical and flat, no distension. There's no rashes, lesions, skin is all intact. A couple moles noted, but they're both less than 6 millimeters and normal. So a couple questions before I listen to your stomach there. Have you had any nausea or vomiting?
Nope.
Constipation, diarrhea?
Nope.
Have you been passing gas?
Yep.
Perfect. And when was your last bowel movement?
Yesterday.
How would you describe that?
Soft and brown.
All right. And how often do you have bowel movements, would you say?
Probably once a day.
Okay, perfect. So I'm going to go ahead and listen now. Perfect, so active bowel sounds are heard in all 4 quadrants. Now I'm just going to give your stomach a little bit of a tap. So there's tympany heard across the abdomen, and lastly, just going to palpate. Any pain with that?
Nope.
So abdomen is soft and non-tender, no lumps felt. Perfect. So a couple more questions. How many times a day do you go pee?
Probably 6 or 7.
And what would you say is the color of your urine?
Pale yellow.
All right, and how much water do you drink?
5 cups maybe?
Perfect. 5 cups a day?
Yeah.
Awesome. And do you have any reproductive concerns at all?
No.
And when was your last menstrual cycle?
3 weeks ago.
Okay, perfect. So now we're going to take a look at your arms. So taking a look at the skin, it is all intact. There's no lesions or rashes. Down to the nails, I noticed no clubbing. Capillary refill is less than 3 seconds. Skin is warm to touch. I'm going to go ahead and feel her radial pulses. Those are felt bilaterally. Brachial pulses felt bilaterally. Skin turgor is non-tenting. So can I just get you to please move your arm up? Perfect. Other arm up. Move your wrists. You've had no numbness or tingling with your arms or hands?
No, nothing like that.
Perfect. So get you to push up on my arm and push up again. And then down on my hands and then grip my hands. Perfect. So circulation, sensation, and movement are all intact. Muscle strength is a 5 out of 5 bilaterally. All right, so now we're gonna move down to your legs, so you can feel free to cover up there up top. And you're okay if I move the blanket down to expose your
definitely.
legs? Awesome. So taking a look at her legs here, they are slightly pale, warm to touch. I noticed no lesions on the skin, no bruising, no varicose veins or edema are noted on the skin. Can you go ahead and bend your knees up for me, please?
Yep.
Awesome. And move your legs, your ankles around. No pain in any of your joints? All right, so joints have full range of motion with no pain as well as no edema. Can you go ahead and push up my hand? Push up again, perfect. And keep push forward my feet. Awesome. Now I'm gonna go ahead and feel the pedal pulses. Those are felt bilaterally. There's toenail polish in our patient, so I can't go ahead and assess capillary refill. However, circulation, sensation, and movement are all intact in the lower extremities. Muscle strength is a 5 out of 5 bilaterally. All right. So that now concludes our assessment today. Just wanted to let you know that all findings were expected, so you have nothing at all to worry about. Do you have any questions or concerns before I go?
No.
All right, well, thank you for letting me do this assessment on you. And I'm just gonna leave your call bell right here on the side for you. And have a good rest of your day.